I'm here with Bonny Specker, epidemiologist from South Dakota State University, who is going to give us an update on COVID-19 and what has been happening with it in our state, in our area, in the United States, and in the world. Bonny, what do you have for us today?
Hi, Chelsea. This week I thought I'd take a closer look at South Dakota hospitalizations, case fatality rates, and deaths in 2020. This first graph shows the percent of population ever testing positive by age as of January 7th, and it's giving data for both Brookings in the yellow and South Dakota in the light blue. And here we have percent on the y-axis, so the percent of individuals within each of these age groups that are shown on the x-axis. And I have some of graphs like this in the weekly update that are posted on the Brookings website, but I also provide a way of interpreting these data. So here, the way you would read it is that 6.5% of the Brookings County residents age 60 to 69 have tested positive for COVID, compared to 10.5% of South Dakotans age 60 to 69. And you can see that in almost all age groups, Brookings has a lower percent of its residents testing positive than the state as a whole, except when we're talking about the less than 20 age group, where Brookings County has 9.5% compared to South Dakota's 6.3%. This is one of the slides that's updated weekly, and in that weekly update that the city posts, and this one is the percent of cases ever hospitalized by age. And you can see that there's a definite increase. Less than 1% of individuals less than 20 have been hospitalized, and it increases quite dramatically with age, going up to close to 27% of 80-year-olds and older. I think it's important to see that this disease does, or this virus does, affect younger individuals as well, with 3% of the 40 to 49-year-olds being hospitalized, and even 1.5% of the 20 to 29-year-olds. Another graph that's provided is the case fatality rates by age. This was updated on January 7th, and I've provided as a comparison the case fatality rates that are being observed in Minnesota. I was able to find sufficient data on the Minnesota Department of Health website to be able to calculate these case fatality rates. But you can see that for ages below 60, the case fatality rate is less than 1%. But it starts rising around in the 60 to 69 year age group. It's 1.8%. Who are of those individuals who are diagnosed with COVID died. And we've got about close to 6% in the 70 to 79 year age group and 20% in the 80 plus. Now there's a couple implications here. I know that some people talk about, why talk about the mortality or the case fatality rates by age? Why not look at things in terms of the percent that have recovered? And one thing I'd like to throw out there is in this 60 to 69 year age group, 1.8% fatality rate. You could look at it and say, well, that's 98.2% that have survived, but a small percent for a large number ends up being a large number. And I've just given an example here where there's an estimated close to 111,000 60 to 69-year-olds in South Dakota. If 80% of those individuals develop COVID, that's close to 2,000 deaths. So yes, it's 98 or 98.2% recover, but that 1.8% that does not represents 2,000 people. So I think that that's something to keep in mind when looking at these graphs and thinking about recovery versus mortality. One of the other graphs that is updated every once a month is the deaths and the total number of deaths as well as death rates per 100,000 population. Now, these data are provided by the South Dakota Department of Health. They're on a different website than the COVID dashboard, and that website's given here at the bottom of the slide. And this is from tables that they've placed on this website, and the information includes the average deaths per 100,000 population between 1960 and 2019. So you can see the average number of deaths in 2019. So you can see the average number of deaths by month. And then the highest number that was observed during this period, as well as the lowest, to sort of give you a range of what's going on. And on top of that, I've superimposed what's happened in 2020 so far. Now, the 2020 death data is provisional. The Department of Health finalizes this data set, and they're in the process of doing that right now. So in probably 4 months, they'll have a final version of the death data, but right now these numbers can change for 2020. But you can see that we have exceeded or close to or exceeded the number of deaths that have been observed for the last 60 years on a per population basis since August of this year. And November had the highest rate, and we know that also from looking at COVID specific deaths, that month was a very high month. It was the worst month so far in terms of deaths. Another way that they presented the data was just for the last 10 years, and instead of giving that range. And here what you see is that 2020 has actually been on the high side since back in March. We've been running a little bit high and then really started pulling away from those other years in September. And again, that the number in November is quite high. And this is absolute number of deaths. If you look at the different causes of death, and I know a lot of people have said, well, all deaths right now are being coded as COVID, and that's why it looks so bad. That's one of the misinformation things that's out there. What this is showing is the number of deaths by cause over the last 10 years in South Dakota. So if we look at this red line, this is heart disease. You can see that it's gone up slightly over the last 10 years and is around 1,600 deaths per year. Cancer is the second leading cause of death right now. This is in 2020 provisional data. If you compare 2019 and 2020, those numbers are not that different. All other causes are for all deaths other than those that are shown or listed individually here. We also have this one group, cause not yet determined. That's this orange line down here, and those are probably death certificates that were incomplete, that are being reviewed, and they haven't yet been able to code them as far as cause of death. But here we have COVID related deaths as of November. And again, this is provisional. This will increase because it doesn't include December deaths. As far as updates for the week ending Sunday, January 10th, Brookings County has had substantial spread this past week. There were increases in the cases among individuals less than 20 years of age and also individuals aged 30 to 49 years. We've had 3,188 cases. 153 of these cases were last week and 134 in the previous week. On Sunday, we had 233 active cases. 110 people have been hospitalized. There were 4 new admissions this week compared to 5 in the previous week. There have been a total of 31 deaths, 1 death this week and 1 death in the previous week. Test positivity is still running high. Among people tested, it's 38%, and among tests done, 13%. Both of these numbers are above the 5% that's recommended by the World Health Organization and the CDC. The good news, 2.8% of Brookings residents have been vaccinated. This is up just a little bit from last Sunday when it was 2.4%, but it is increasing. As far as South Dakota, it's still in substantial spread. You can see that here, that's showing the cutoff for substantial spread. We've had 103, a little bit over 103,000 cases, almost 3,000 cases this week compared to about 3,000 in the previous week. So pretty steady. Again, you can see that in this graph with not a lot of change in that yellow line. As of Sunday, there were 5,040 active cases. Close to 6,000 individuals have been hospitalized, and the admissions have been pretty steady. We had 172 this week compared to 171 in the previous week. There were 237 individuals hospitalized. 54 of them were in the ICU. We've had 1,585 deaths, 72 this week compared to 67 in the previous week. Test positivity for the state is also running high, 34% among people tested, 9% among tests done. And 4.2% of South Dakotans have been vaccinated compared to 3% last Sunday. And South Dakota actually is first in the nation as far as the highest percent of the state's populations that have been vaccinated. So that's a really good sign. As far as the US, we've had close to 23 million cases, 1.79 million new cases this week, compared to 1.47 million in the previous week. And you can see that there is this increase that's occurring throughout the country. We've had over 381,000 total deaths, close to 23,000 this week compared to close to 19,000 the previous week. And we actually had quite a few days with over 4,000 deaths being posted in one day. Worldwide, we've had 90 million cases, about 5 million this week compared to 4.26 in the previous week. 1.93 million deaths, 90,000 deaths this week compared to 73,000 in the previous week. And you can see the changes that are happening here. And again, all of these slides are included in the weekly updates or daily updates that the city posts. And I wanted to mention again, the South Dakota Department of Health has started a free at-home testing program. You can go to this website and order it. One of the nice things about this is that you can actually order the kits. They're shipped to you and you can keep them until they're needed. So, check out that website, maybe order some kits to have on hand in case you think that you need them. You can cut off a couple days by already having them available. If you have any symptoms or were in contact with someone who developed symptoms or tested positive, it really would be a good idea to get tested. It will help prevent the spread of this virus. Thank you and keep up the good work.
Well, thank you, Bonnie. I appreciate it. For those of you who watch these videos every week, if you have a question, please email us at the email address that's included in the description of this video, and we can get those questions answered for you. Have a great week.